Hi everyone, today we will learn in this video about push tool. What is push tool? It is a pressure ulcer scale for healing. We will see what is this and how to use this and how to measure, how to assess the patient wound one by one. What is push tool? It is a just tool to know the healing status of a pressure injury, whereas the Braden scale, which is giving in our previous video, I have already explained about Braden scale, which is helping us to assess the pressure injury risk. But in push scale, it is helping us to know the healing status and prognosis of the patient. Okay, what is the important? So now we understood the importance of push tool. Unlike the Braden scale, which is assessing the risk. The push tool helps us to monitor the wound progress and effectiveness of our care plan. Whether our nursing care is effective or not, we can cross-check with that. What will be our goal? Our goal is to use the push tool accurately for assessing the skin and promote the patient's safety and healing. It helps us to ensure the positive prognosis of the patient. Okay, let's see next. For the effective use of push tool, there are some parameters we have to use. There are three parameters that are considered most indicators of the healing. Okay. The first parameter is length into width. The second one is exudate amount. The third one is tissue type. Length into width means the size of the wound. Exudate amount is nothing but the drainage which is coming out from the open wound. So when we will open the dressing, before applying any topper agent, we can see what drainage is coming out. Accordingly, we will take the score. Okay. And tissue type. The type of the tissue is visible on the wound bed. Accordingly, we will see the parameters. Let us see one by one how it is calculating. This is the push chart. Okay. The first parameter is length into width. For that, we are giving the mark is score is 0 to 10. Okay. 0, 1, 2, 3 and 3, 4, 5, 6, 7, 8, 9, 10. 0 to 10 is the mark. The measurement also here given accordingly in centimeters. Okay. We are measuring in centimeters. So above 24 means it will be 10. And in between 24 to 12 to 24 means it will be 9. So accordingly it is written here. You can go through this chart. So once after the length and width, we have to check, and after that what is the sub score we will get, that we have to mention over here. The same way, exudate amount is 0 to 3 score we are giving according to 0 means none and 3 means heavy drainage is there. Accordingly, what score we are getting? Well, if it is a moderate, the sub score will be 2. If it is a light, sub score will be 1. Accordingly, we have to write the sub score over here. And the tissue type. We have to check the type of the tissue, whether epithelial tissue present, granulation tissue is there, or slough is there, or necrotic tissue is there. So accordingly, that one 0 to 4 scores are there. What score we are getting, that score we have to write marked over here. At last, we have to calculate total how much we are getting. Accordingly, we are getting the push scale mark. So like that we have to do. After that, we will go for the another chart. Then we will see every day, once in 24 hours, we will check this one, and every day we will see how is the prognosis of the wound healing is happening. We can find out from that. Now let us see how to measure. I told you there are three parameters. Length into width we have to measure. How we will measure? Let us see one by one. First parameter is length into width. Always the length has to be measured from head to toe. head to 2. That is why it is written head, and the 12 o'clock coming, that is head. If you are imagine this is a clock and the 12 o'clock will come over here, the 6 p.m. evening time it will come here. So head to 2 we have to measure from here longer one. Use the always for measuring, we should not assume this much will be there. So it should not be guessing and all. Guessing things and all should not be happen. We have to use a centimeter ruler and hold from here to here. It should be marked. How much is there? Head to 2. The measure the greater length head to 2 and the greater width side to side. So width will be side to side, length will be head to 2, and multiply these two measurements to get the surface area in centimeter. So for example, I will tell the length when we were measuring, the length was 6 centimeter and the width were 5 centimeter. So 6 into 5 when we are multiplying, we will get 30 centimeter because we are taking in a centimeter. So 30 centimeter square. Okay. It's very, very important points to be remembered that we should never ever guess the measurement. Always use the same method and a centimeter ruler. Okay. Another parameter is, second parameter is exudate amount. Exudate amount, I have already told you, it is an estimate amount of the drainage present after removing the old dressing and before applying new agent. Without even cleaning, without applying any of the ointment or any of the solution, we should see what is the drainage coming out from the wound. So that is that we can't measure. We have to estimate it. Approximately this one is this. The scoring will be starting with the 0 to 3, and in the scoring 0 is the wound will be very dry. Nothing is there, no oozing at all, and the wound is very dry. We will give the 0. And very lightly, slightly it is drainage is coming, means score will be 1. Score 2 if there is a moderate drainage. Score 3 if the heavy drainage. Then these things we have to mark in the chart. The previously I have told you already the chart, we have to mark it off. The third parameter is tissue type. This is refers to the type of tissue present in the wound bed. How we will give the scoring? Score we will give 0 to 4. So the score here it is score 4 start with the necrotic tissue. Necrotic tissue means black or brown tissue. It is also known as eschar, and that is firmly attached to the wound. Score 3 that is for slush. Yellow or white tissue often thick and stringy. Score 2 will give granulation tissue, pink, shiny and moistened tissue that is indicate a new growth. Okay, and slowly the growth is starting, the new skin is start coming in the edges. Score 1 will give for the epithelial tissue. Superficial, it is a pink, the starting stage of the wound. Superficial pink tissue, that is a new skin forming at the wound edges. And score 0, closed. Wound is completely healed and it is started with new skin. Let us see the pictorial representation of the tissue type. I have told you closed tissue. Closed means 0 scoring. This is the picture. See, you can see if the wound is fully covered with this new skin, pink, light, peach in color. Skin is already coming. Now there is nothing, no drainage, nothing is there, no infections, no redness around it. So this is closed, 0 score. And next one is epithelial tissue. Superficial, pink in color, new skin at the edges of the wound. You can see the edges of the wound. It is starting a new skin and the color is really pink in color. And in the middle is very, very, very dark in pink. The third picture is showing granulation tissue, pink, shiny and bumpy tissues are coming. See, you can see this is the third stage of the granulation tissue. Okay, and another picture. Another one is a flush. It is a yellow or white tissue often appearing as the thick clams. See, yellow, it is in the middle. See, very thick. We have to, this is a slush. Okay, here also there is a slush. And surrounding and surround and all, it is a pink in color. Something like a bit, it will take a long time for the healing purpose. Okay, this is the third one. And the fourth one is narcotic tissue. Necrotic tissue. I'm so sorry. Necrotic tissue. Black, brown tissues firmly adheres to the wound. See, you can see this one. This is the necrotic tissue. Okay, and slush also is there. This is not at all a healthy wound. This is very infected look. So we need the more care and treatment. Accordingly, the wound will see and the appearance of the wound, we have to plan about the nursing care also, wound care also. Okay, then only it will heal off. Sometimes it may go to the surgical also, according to the wound deep how it is. So, but this pressure sore, sizes, stages, in the next class we will discuss. So now we got the score for all three parameters, and all three parameters score we have made the total also. Total total thing also we got. That total thing, it is starting from, the score is starting from 0, 0, 1, 2, 3 start. So how we will know the process of healing, how it is, whether it is happening in a healthy way or we need to change our care plan or not. For that only we will use our graph. Okay, pressure healing graph is there. Healing graph we have to go. After what we have to do, accordingly the score will be given. That once after getting the score, we should calculate all together, and that at last we will get one score. Then that score, total score, we have to put it in the graph. Okay, then we will follow the healing graph where we have to mark the score daily. Daily we have to mark the score, and we have to find out the healing process of the pressure ulcer wound. Once the score is coming down, the healing factor is occurring. If the score is going up, the healing progress is worsening. That is the meaning. So, as the score is decreasing, the wound is healing. As the score is increasing, the wound condition is worsening. So, what is our goal here? Plot the push score on a graph regularly to track the healing process. So let us see what is how we will put the score in graph. This is the healing graph. Okay, so graph is starting from 0, and in this graph it is ending by 17. Okay, so if you are getting total calculated score is 2, we have to mark it in a, see, this is the 0 level, this is 1, down it is 2, 3 accordingly. So we have to mark it over here. So daily, every day, once in every day we have to, in every shift, if we are checking in every shift, whenever we are checking the parameters, accordingly we have to mark also. Okay, and down we are putting the date. But always we are recommending once in 24 hours checking is enough. Daily once it is enough. So we have to mark it, and if the parameter, if the graph is going up, the meaning is our nursing care is coming down. We have to change our care plan. If the graph is coming down, the total mark we are total score we are getting low, because the healing process is happening in good, and we can continue what we are doing. Okay, that is the meaning of healing. This is the way we are maintaining the healing graph. Once if it is, we are changed, for example, we changed maximum raise, we have done, then things has to be changed from the nursing to it is going to the surgeon. We have to show to the surgeon and surgeon will decide what to do for this wound. Sometimes there is some surgical management also need to be do in according to the stages of the pressure wound. Okay. How to promote fast healing? So for that we have to give the important link surface. Ensure the patient has a right support surface. Example, pressure redistribution mattress. That is, what is that? Air mattress we used to put, or water bed, whatever we are putting to be applied. Skin inspection. Whenever we are changing the position of the patient, we should conduct the early also, and every time whenever we are changing position, we are giving the care for the patient, we should inspect the skin of the patient, whether patient is getting or whether there is a chance any this one new pressure so can happen. So conduct early also, and regular skin inspection is needed. Teach the patient and the caregivers what to look for that, especially if there is a pressure wound, what in the pressure wound they have to do, that we have to teach them. Okay. And if even if there is any bony prominence is present, that we have to teach them how it is, and surgical opinion we have to go through. These all are things, all these things we have to be always remembering. Skin inspection. Mobilize. Encourage the movement and reposition of the patient frequently to prevent the prolonged pressure on the same particular area. So, promote the patient and encourage the patient to positioning and move from bed to chair, chair to bed, and if possible, if the disease condition is allowing, make the patient to mobilize walking. Okay. As early as mobilize the patient, we can prevent the bed sore. Moisture. Keep the patient's skin clean and dry. If the patient passed urine, motion, if any spillage happen on the bed, soon we should change the bed sheet, keep the patient to be clean, dry their skin. So excessive moisture should not be there. That will break down the skin if excessive moisture is there. No, next is nutrition. Ensure the patient should get adequate diet, plenty of fluid, nutritional, essential nutrition, which is helping for healing the wound, like protein, vitamin A, C, zinc. These all things has to be. These are things. Once patient is having bed sore, we should inform our nutritionist. They will add in the food. If the patient is getting food from the hospital, they will prepare accordingly. Otherwise, nutritionist will be explaining the patient attendant. Accordingly, they will bring the food. So, very important role is there for the nutrition for healing the wound. Conclusion: prevent, do not treat. The cost of treating a pressure injury is very high. It is far more effective and beneficial to prevent them in the first place. Instead of treating the pressure ulcer, better we have to prevent which is should not be come. So our Braden scale has to be applied. Hospital acquired pressure ulcer is the negligence of nursing care. Okay, always remember that. Global Pressure Injury Day we are celebrating on November, worldwide we are celebrating November 19th. It's raising awareness about the important, what is the use of celebration? It is raising the awareness about the importance of prevention and proper care for the pressure ulcer. By using tool like Braden scale and push tool, we can ensure the patients receive the best care and remain safe and comfort. Thank you.